Is right now at 6. In exactly 1 week, Minnesota's current restrictions are set to expire. But will Governor Tim Walz let them run out, or will he re-up them? He is expected to announce a decision on Monday. Now, as you know, under the current restrictions, gyms, youth sports, and dining at restaurants or bars all off limits. Also happening on Monday, Minnesota lawmakers plan to discuss relief for small businesses during another special session. There are some people, though, that aren't waiting to see if the restrictions will roll back. There's just been another lawsuit against the governor and the state. This one's about the current pause on youth sports. It's a recently formed nonprofit leading this suit. It's called Let Them Play. The lawsuit says that the state isn't listening to science and data, and it claims that banning youth sports actually increases the spread of COVID-19. It's also calling that sports ban an arbitrary and irrational burden. Now, according to Minnesota's data, teenagers, the older set of teenagers, that 15 to 19 age group, are currently making up about 10% of Minnesota's COVID cases. There is another push to expand COVID-19 testing options today, and this time it's happening at the country's biggest mall right here in Minnesota, Mall of America. They're now hosting a rapid testing site. That's a drive-through location. It's in the far north parking lot. It does open up this morning. It's going to look similar to what this testing site looks like. Organizers expect it'll take about 30 minutes. That's quick to get your results back. And most insurances will cover the cost of the test, but if yours does not, each test costs $99. At this site, you do not need symptoms. You do not need exposure to get tested, but they do recommend you get an appointment. The Mall of America is just the latest in a number of new testing sites to pop up around Minnesota recently, and that push to expand access is showing no signs of slowing down. Our Christiane Cordero is live at the Mall of America this morning with the latest on the efforts for Minnesota's fight against this outbreak. Christiane.
Yeah, Heather, good morning to you. So we're just northeast of the Mall of America, right across from American Boulevard. And this location and the timing of it is all kind of coming into play here, with it being near the airport, near the mall, around the holiday season. And speaking of timing, it is a rapid test too, right? So that is a factor. As Heather mentioned, you should get your results here in 30 minutes or less. When we look at the other options around the state, Hy-Vee just opened up new testing sites in 18 pharmacies, and it's expanding. Also a rapid test with results expected within a couple of hours. At Hy-Vee, you either need symptoms or known exposure, though, to get tested. The purpose of rapid testing is to help slow the spread by isolating positive cases faster. Minnesota's positivity rate as of yesterday's weekly report sits at 8%, higher than the ideal 5% threshold, lower than the 14% peak that we saw about a month ago. And Governor Walz, he will speak today about that and possibly other things, right? And he'll also speak on Monday. Monday's the really big one, though. That's when we'll learn more about the dial-back restrictions on Minnesota businesses and gatherings, and a special session on economic relief. Today's announcement is expected to be a little bit more of a caution, perhaps touching on holiday travel on this expanded testing sites, and then leading into Monday, which again, Heather, is really what we're stressing here, because the dial-back is set to expire in 1 week, and then businesses are really hanging on tight until then.
Right, they are. And you know what helps, Christiane, testing sites like that, especially those ones that are quick? We're not seeing a lot of those quick ones around the state here.
Right. Right. So this one, if it does kind of fall into that 30-minute timeline, even if it's within a day, I think would help tremendously.
Right. All right. Christiane Cordero live at the Mall of America this morning. Thank you. Yesterday, more than 3,000 COVID-19 deaths were reported nationwide. That's more people killed in one day from the virus than were killed on 9/11. Yesterday was also the deadliest since the pandemic began. It broke the record set just 1 day earlier. There is some good news, though. A COVID-19 vaccine in the U.S. is one more step, just one away from becoming a reality for thousands of Americans. Yesterday, an FDA panel recommended Pfizer's vaccine for approval. So now the FDA could give it the green light at any moment, and then it's off to the races. Millions of the shots will be shipped out, they say, right after they get the okay. Bofta Yimam explains the ongoing efforts to get the vaccines on the road.
comprehensive and independent review of the data.
A government advisory panel voted to recommend widespread use of the coronavirus vaccine from Pfizer and BioNTech yesterday.
So we do have a favorable vote.
The Food and Drug Administration is now expected to follow suit.
We could see FDA authorization of the first vaccine in the United States within days.
Health and Human Services Secretary Alex Azar says doses will start shipping within 24 hours of the FDA's emergency use authorization.
I'm on call for when it gets delivered.
Some hospitals have already been sent vaccine kits containing syringes, masks, and a diluting agent.
The logistics here are going to be complex, but we're really excited about it.
The vaccine is coming at a time when the U.S. is seeing a record number of daily deaths. More than 3,100 Americans died on Wednesday.
COVID-19 was the #1 cause of death in Idaho in November.
The first doses will go to healthcare workers and nursing home residents, with most of the general public not expected to get the shots until the spring.
The whole country's on fire. This crisis that we have right now, the vaccine is not going to save us.
Health workers are concerned the holiday season is just making matters worse.
It's very frustrating for us because we're trying to save people and take care of you.
Next week, the vaccine from Moderna is scheduled to go through the same approval process as the Pfizer-BioNTech vaccine. Bofta Imam, CBS News, Washington.
So here are the next steps that we can expect here in Minnesota. Vaccine should arrive the week of December 14th. Shortly thereafter, training will be provided for those who are going to administer the vaccine. Minnesota is expected to get around 183,000 doses in the first 4 weeks. Now, it's the week of December 21st. That's the target for the first doses to go to the healthcare workers and the residents in long-term care facilities. In Wisconsin, they'll get 50,000 doses of the vaccine to start. Health officials there expect those doses to come out sometime this month. They don't have any set dates in Wisconsin. They hope to be administering their first doses before the end of the year. Frontline workers will be the first to get the shots, and they expect it'll take at least 2 months to vaccinate Wisconsin's 450,000 healthcare workers. So there are some sports that you just don't usually see